When I was thinking about like dental implants, price expensive. So I just kind of want to address that in straight on is, let's walk through the different ranges of fees, and then what are the options for patients? Because obviously they're out there, they're doing the research,
Totally.
and they're looking for a practice they can trust.
Totally. So I'll see a lot of, thinking about doing research, I see a lot of ads that have a bunch of crazy prices and things on them. They're kind of ridiculous because most docs usually, you're probably around 5,000, 5,500.
Yeah.
For a single tooth replacement.
Okay.
A lot of patients will think, oh my, I had 32 teeth, however many, and you've got to do that times 5. That's not the case.
That's a good thing. Can you expand on that a little bit? That's really good to know.
So if you're a patient that doesn't have any teeth, or you have a partial, full denture, whatever, you only typically will need 4 implants to do a full arch. On the top and bottom. It's always nice if you can do 1 or 2 more. That is just, more support for the prosthesis, depending on your bite, a few other factors.
Yeah.
You may need, up to 6. I've seen people that have 8. It's not always necessary, but it gives you some variability down the road on, if anything would happen. So.
Okay. And you put a full denture on top, or a denture on top of that. That's what okay, cool.
Yes.
So if I get 4 implants, then I put a denture on top of that and it locks it in.
Yeah.
Which is completely unlike what we talked about before, which is removable dentures. You lose all that and you're dealing with a different issue. Yeah.
Absolutely. And with the other great thing about implants that I didn't mention earlier, they don't put stress on your other teeth. With a partial, with a bridge, you're putting stress on the other teeth that can sometimes lead to some issues. So. Okay,
cool. So then, this is great to know. And then 5,500 so you could be looking at, if I need 1 implant, 5,500 to say 6 implants, it might be around $30-something thousand.
If you're doing a full arch, usually the top side of that is about 30,000. You can have that done for as little. And that's, keep in mind, if you're starting from nothing. If you come in and you don't have a denture in hand, you don't have anything. You've got gums and a jaw.
Okay.
That's when you're going to be at that 30,000-ish mark. If you already have a denture, there's a lot of times we can retrofit that to implants. Sometimes we can't, kind of depends on the current denture.
Yeah.
The other thing we can do, there's a couple different types of implant supported denture. So one is bolted on there, much like you would bolt, a picture on the wall, what have you, that you come see us every 6 months. We take it off, clean everything out, make sure things are great. There's another kind that is, you can remove each night at home, and it utilizes some fittings that kind of snap on. So it's solid all day long, but then if you need to clean or you need to do anything, pop it out, clean it at home, pop it right back in, you're good to go.
Okay, great.
And those are typically, they can be anywhere from 15 to 20,000, depending on what type of denture that you have made, if you need one made, or how many implants are there that you have to do fittings for.
Okay, awesome.